மத்திய அரசு மாநில அரசில் நடத்தக்கூடிய எக்ஸாமோட ஒரிஜினல் கொஷின் பேப்பர் வித் ஆன்சரோட பார்த்துட்டு வரோம். அந்த வரிசையில் ஸ்டாஃப் நர்ஸ் கொஷின் பேப்பர் வித் ஆன்சர். கொஷின் நம்பர் 1, which of the following is the best and most sensitive investigation for hypothyroidism? Correct answer is TSH. Which of the following is the best and most sensitive investigation for hypothyroidism? Correct answer is TSH level. Question number 2, in the following which is the common side effect of antihistamines? Correct answer is option A, sedation. In the following which is the common side effect of antihistamines? Correct answer is sedation. Question number 3, cold shock is also called as? Correct answer is option C, hypovolemic shock. Cold shock is also called as hypovolemic shock. Question number 4, immediate treatment of ingestion of poisonous subjects is? Option C, gastric lavage. Immediate treatment of ingestion of poisonous subjects is gastric lavage. Question number 5, oral medicine cannot to be given to the client having dysentery. Oral medicine cannot to be given to the client having dysentery. Option C is correct answer. Question number 6, the primary reason for nurses to use nursing care plan is? Correct option is B, identify patient's problems. The primary reason for nurses to use nursing care plan is to identify patient's problem. Question number 7, disinfection of patient's unit after discharge or death of the patient is called? Terminal disinfection. Disinfection of patient's unit after discharge or death of the patient is called terminal disinfection. Question number 8, sensitivity and reaction of a drug is tested by administering the drug? Option B is correct answer, intradermally. Sensitivity and reaction of a drug is tested by administering the drug intradermally. Question number 9, nursing assessment of neurovascular status of the extremity with a cast include the following? Correct answer is option D, except range of motion. Nursing assessment of neurovascular status of the extremity with a cast include the following except range of motion. Include pallor, pain, paresthesia. Correct option is option D, range of motion, except range of motion. Question number 10, eye padding is applied to unconscious patient to prevent? Correct answer is option C, corneal ulcer. Eye padding is applied to unconscious patient to prevent corneal ulcer. Question number 11, infection from urinary catheter can be best prevented by cleansing around the meatus periodically. Infection from urinary catheter can be best prevented by cleansing around the meatus periodically. Question number 12, height of the enema cane from anus when giving enema should be 45 centimeter. Correct answer is 45 centimeter. Height of the enema cane from anus when giving enema should be 45 centimeter. Question number 13, Before administering the medicine to a patient, a nurse checks the prescription 3 times. Before administering the medicine to a patient, a nurse checks the prescription 3 times. Question number 14. The clinical manifestation that are objective are termed as sign. Correct option is A. The clinical manifestations that are objective are termed as sign. Question number 15. A patient has undergone bronchoscopy. The nurse should be alert for which of the following complication? Correct option is option D. Pneumothorax. A patient has undergone bronchoscopy. The nurse should be alert for which of the following complication? Pneumothorax. Correct answer is option D. Question number 16. When a nurse is doing surgical hand washing, she should keep her hands above elbow. When a nurse is doing surgical hand washing, she should keep her hands above elbow. Above elbow. Question number 17. The process of assessing patients who come to emergency department and determining the management priorities is called triage. The process of assessing patients who come to emergency department and determining the management priorities is called triage. Question number 18. Which of the following is used to assess the level of consciousness? Correct answer is option C. Glasgow Coma Scale. Which of the following is used to assess the level of consciousness? Level of consciousness, Glasgow Coma Scale. Question number 19. Primary prevention includes health promotion and specific protection. Primary prevention includes health promotion and specific protection. Question number 20. Measles vaccine should be used within the following time after reconstitution. Correct answer is option A. 4 hours. Measles vaccine should be used within the following time after reconstitution 4 hours. Correct option is option A. 4 hours. Question number 21. In the following, which is not a group approach of health communication? Correct answer is option A. Demonstration. In following, which is not a group approach of health communication? Not a group. Correct answer is option A. Demonstration. Question number 22. In following, which is not an absolute contraindication of IUD? Correct answer is option D. Anemia. In following, which is not an absolute contraindication of IUD? Anemia. 23. Waste shops such as needles, syringes, scalpels and blades are kept in blue bag. Waste shops such as needles, syringes, scalpels and blades are kept in blue bag. Question number 24. The stage of disease cycle in which patients starts to feel better is? Correct answer is option C. Defervescence. The stage of disease cycle in which patients start to feel better is defervescence. Question number 25. The constant presence of disease within a geographical area is known as endemic. Correct answer is option B. Endemic. Within a geographical area, endemic. The constant presence of disease within a geographical area is known as endemic. Question number 26. Chikungunya fever is transmitted by Aedes aegypti. Chikungunya fever is transmitted by Aedes aegypti. Question number 27. Cold chain is used for storage of vaccines. Cold chain is used for storage of vaccines. Question number 28. In following, which is a cyanotic congenital heart disease? Correct answer is option D, tricuspid atresia. In following, which is a cyanotic congenital heart disease? Tricuspid atresia. Question number 29. A baby is considered normal if APGAR score is more than 8. A baby is considered normal if APGAR score is more than 8. Question number 30. Anti-embolic stockings can help to reduce. Correct answer is option A, thromboembolism. Anti-embolic stockings can help to reduce thromboembolism. Question number 31. In a neonate suffering from septicemia, which medicine is used to prevent bleeding? Correct answer is option D, injection of vitamin K. In a neonate suffering from septicemia, which medicine is used to prevent bleeding? Injection of vitamin K. Question number 32. Code of ethics for a nurse include except. Correct answer is option C. A nurse is not responsible for maintaining highest standard of nursing care. Except code of ethics for a nurse include except nurse is not responsible for maintaining highest standard of nursing care. Responsibility of a nurse. Question number 33. Complication of phototherapy is a neonate include except hypothermia. Complication of phototherapy in a neonate include except hypothermia. Question number 34. Management of nephrotic syndrome include except high sodium and low protein diet. Management of nephrotic syndrome include except high sodium and low protein diet. Question number 35. Antisocial behavior when a child or adolescent purposefully and repeatedly does illegal activities is known as juvenile delinquency. Antisocial behavior when a child or adolescent purposefully and repeatedly does illegal activity is known as juvenile delinquency. Question number 36. When assessing a child with a chronic hypoxia, the nurse should monitor for clubbing of fingers. When assessing a child with chronic hypoxia, the nurse should monitor for clubbing of fingers. Question number 37. 1 tablespoon is same as 15 ml. 1 tablespoon is same as 15 ml. Question number 38. 5% dextrose in normal saline is hypertonic solution. 5% dextrose in normal saline is hypertonic solution. Question number 39. Meaning of abbreviation GTT is a drop. Meaning of abbreviation GTT is a drop. Question number 40. maximum amount of a drug can be given through IM route? 5 ml. Maximum amount of drug can be given through IM route, 5 ml. Question number 41. When a drug is prescribed with symbol AC, it means the drug should be given before meals. When a drug is prescribed with symbol AC, it means the drug should be given before meal. Before meal. Question number 42. At term, the weight of the placenta is about 500 gram. At term, the weight of placenta is about 500 gram. Question number 43. Braxton Hicks contraction or uterine contraction in pregnancy. Braxton Hicks contractions or uterine contractions in pregnancy. Question number 44. The slight depressed marks predominantly found on the abdomen below the umbilicals during pregnancy is termed as, correct option is option C, striae gravidarum. The slight depressed marks predominantly found on the abdomen below the umbilicals during pregnancy is termed as striae gravidarum. Question number 45. The importance of research in nursing is to provide evidence-based nursing care. The importance of research in nursing is to provide evidence-based nursing care. Question number 46. Cervical changes that takes place during pregnancy. Correct answer is option C, bluish discoloration of the cervix. Cervical changes that takes place during pregnancy, bluish discoloration of the cervix. Question number 47. Duration of first stage of labor in primigravida is approximately, correct answer is option A, 10 to 12 hours. Duration of first stage of labor in primigravida is approximately 10 to 12 hours. Question number 48. In following, which is a welcome sign of pregnancy? Lightening. In following, which is a welcome sign of pregnancy? Lightening. Question number 49. Formula for calculating EDD is, correct option is option A, first day of last MC plus 280 days. Formula for calculating EDD is first day of last MC plus 280 days. Question number 50. Hydatiform mole is a disease of, correct answer is option B, chorion. Hydatiform mole is a disease of chorion. Question number 51. Side effect of use of oxytocin is all of the above. Uterine rupture, low BP, water intoxication. Side effect of use of oxytocin is uterine rupture, low BP, water intoxication. Question number 52. The nutrient essential for bodybuilding and repair and maintenance of body tissue is protein. The nutrient essential for bodybuilding and repair and maintenance of body tissue is protein. Question number 53. Vitamin A is also known as retinol. Vitamin A is also known as retinol. Vitamin A, retinol. Question number 54. Pellagra is caused due to deficiency of niacin. Pellagra is caused due to deficiency of niacin. Pellagra, niacin. Question number 55. Which is the most common hospital acquired infection? Urinary tract infection. Which is the most common hospital acquired infection? Urinary tract infection. Question number 56. A man whose body mass index BMI is 22, he is normal. A man whose body mass index BMI is 22, he is normal. Question number 57. In following which is not a disorder of motor activity? Not a disorder. Delusion. Not a disorder of motor activity. Delusion. Question number 58. Claustrophobia is defined as irrational fear of closed places. Claustrophobia is defined as irrational fear of closed places. Question number 59. Following are the examples of psychotropic drugs except. Correct answer is option C. Deriphyllin. Following are the example of psychotropic drugs except deriphyllin. So, psychotropic drugs are risperidone, lithium, impiramine, except option C is correct answer. Question number 60. In the following, which is not a thought disorder? Not a thought disorder. Amnesia. Amnesia is not a thought disorder. Remaining all are thought disorder. Hypochondria, flight of ideas, tangentiality. These are thought disorder, not a thought of disorder. Amnesia. Question number 61. Nursing interventions should be given during ECT except remove lipstick and nail polish. Except remove lipstick and nail polish. Nursing intervention should be given during ECT. Interventions such as place well padded mouth gags, flexion on the head with support to the chin, make an observation of grand mal seizure. So, except option C is correct answer. Question number 62. In the following, which is not a psychiatric emergency? Mania. In the following, which is not a psychiatric emergency? Not a psychiatric emergency. Mania. Remaining suicide, stupor, excited behavior or psychiatric emergency. So, correct answer is option B. Question number 63. Therapeutic blood lithium level is 0.8 to 1.2 mE per liter. Therapeutic blood lithium level is 0.8 to 1.2. Correct answer is option A. Question number 64. Ram Prakash, a 30 years old person, asks his family members that someone is standing outside. When family members see outside, there is nothing. Which of the following problem Ram Prakash has? Correct answer is option A. Hallucination. Ram Prakash, a 30 years old person, asks his family members that someone is standing outside. When a family member see outside, there is nothing. Which of the following problem Ram Prakash has? Hallucination. Question number 65. Mr. Pratap, a 42 years old male, has been admitted in a psychiatric ward. Psychiatrist asks that Mr. Kalyan is suffering from mania. Which of the following symptoms may present in Mr. Pratap. Correct answer is option D. Increased PMA. Increased PMA. Mr. Pratap, a 42 years old male, has been admitted in psychiatric ward. Psychiatrist asks that Mr. Kalyan is suffering from mania. Which of the following symptom may present in Mr. Pratap? Increased PMA. Option D is the correct answer. Question number 66. An eating disorder in which patient eats non-nutritive substances such as plaster, soil, etc. is known as PICA. An eating disorder in which patient eats non-nutritive substances such as plaster, soil, etc. is known as PICA. Question number 67. Question number 67. T-tube drainage is used after the following surgical procedure. Correct answer is option B. Cholecytectomy. T-tube drainage is used after the following surgical procedure. Cholecytectomy. Question number 68. The most important assessment for the nurse to make for a patient having severe allergic reaction is, correct answer is option D. Blood pressure. The most important assessment for the nurse to make for a patient having severe allergic reaction is blood pressure. Question number 69. Projectile vomiting is the feature of pyrolic stenosis. Projectile vomiting is the feature of, correct answer is option B, pyloric stenosis. Question number 70. While preparing care plan for a patient scheduled for cataract surgery, which will be the most appropriate diagnosis? Correct answer is option D, altered visual perception. While preparing care plan for a patient scheduled for a cataract surgery, which will be the most appropriate diagnosis? Altered visual perception. Question number 71. To prevent legal implications, what should be done by a nurse during pre-operative period? Correct answer is option B. Obtain written consent. To prevent legal implications, which should be done by a nurse during pre-operative period? Obtain a written consent. Question number 72. Concentration of xyloxine which is used for spill anesthesia is, correct answer is option A, 5%. Concentration of xyloxine which is used for spill anesthesia is 5%. Question number 73. The earliest sign of the post-operative shock is monitored by nurse by observing the pulse rate. Correct answer is option A, pulse rate. The earliest sign of the post-operative shock is monitored by nurse by observing the pulse rate. Question number 74. Dumping syndrome is a complication of subtotal gastrectomy. Dumping syndrome is a complication of subtotal gastrectomy. Correct answer is option B. Question number 75. A localized abnormal dilation of any blood vessel is called, correct answer is option C, aneurysm. A localized abnormal dilation of any blood vessel is called aneurysm. Question number 76. The non-modifiable risk factors for hypertension include all except obesity. The non-modifiable risk factor for hypertension are age, genetic factor and sex. These are non-modifiable risk factors except obesity. So correct answer is option C. Question number 77. What is the primary reason for the gradual change of position of the patient after surgery? Correct answer is option A. To prevent sudden drop of BP. What is the primary reason for the gradual change of position of the patient after surgery? To prevent sudden drop of BP. Question number 78. In head injury, mannitol is given to decrease ICP. In head injury, mannitol is given to decrease ICP. Question number 79. The most likely effect of external radiation to the neck for cancer of larynx is sore throat. The most likely effect of external radiation to the neck for cancer of larynx is sore throat. Question number 80. Purpose of traction is immobilization of affected part. Purpose of traction is immobilization of affected part. Purpose of traction is immobilization of affected part. Question number 81. When charting in the client's chart room record, the nurse must needs to do which one of the following thing? Correct answer is option A. Date and sign each entry. When charting in the client's chart record, the nurse must needs to do which one of the following things? Date and sign each entry. Question number 82. The doctor writes an order for a liquid oral medication. The order says to administer 15 gram by mouth every 4 hours as needed for sore throat. Pharmacy dispenses you with 30 mg per 3 ml. How many ml will you administer per dose? Correct answer is option C. 1.5 ml per dose. 1.5 ml per dose. The doctor writes an order for a liquid oral medication. The order says to administer 15 mg by mouth every 4 hours. Every 4 hours for sore throat. Pharmacy dispense 30 mg per 3 ml. How many ml you will administer per dose? 1.5 ml per dose. Question number 83. The doctor writes an order to infuse a solution. The order reads infuse 300 ml over 6 hours. What is the hourly rate? ml per hour. 300 ml over 6 hours. So, correct answer is option A. 50 ml. 50 ml per hour. The doctor writes an order to infuse a solution. The order reads infuse 300 ml over 6 hours. What is the hourly rate? ml per hour. 50 ml per hour. Question number 84. Benign tumor of blood vessel is called hemangioma. Benign tumor of blood vessel is called hemangioma. Question number 85. Principles of health education include all except punishment. Correct answer is option B. Punishment. Principle of health education include participation, motivation, reinforcement except punishment. So, correct answer is option B. 86. In which defense mechanism we make excuse giving a reason different from the real one for what we are doing? Correct answer is option B. Rationalization. In which defense mechanism we make excuse giving a reason different from the real one for what we are doing? Rationalization. Question number 87. Which of the following microorganism can cause dysentery? Correct answer is option D. All of these. That is Shigella, Entamoeba histolytica, E. coli. Which of the following microorganism can cause dysentery? Shigella, Entamoeba histolytica, E. coli. Correct answer is option D. All of these. Question number 88. The interval between exposure to infection and the appearance of the first symptoms is known as incubation period. The interval between the exposure to infection and the appearance of the first symptoms is called incubation period. Question number 89. Autoclaving, a means of sterilization, will destroy all microorganisms. Autoclaving, a mean of sterilization, will destroy all microorganisms. Question number 90. What is true about carbamazepine? Correct answer is option D. Both B and C. That is, it is an anti-epileptic drug. It is a mood stabilizer drug. What is true about carbamazepine? Correct answer is option D. Both B and C. It is an anti-epileptic drug and it is a mood stabilizer drug. Question number 91. Which of the following statements made by the patient is true regarding position after cataract surgery? True. Correct answer is option A. I will sleep on the unaffected side. Which of the following statement made by the patient is true regarding positioning after cataract surgery? I will sleep on the unaffected side. Question number 92. What type of patient would benefit from an elevated head of the bed position? Correct answer is patient with burns of the face and head. What type of patient would benefit from an elevated head of the bed position? Patient with burns of face and head. Question number 93. A nurse has developed a nursing diagnosis of ineffective airway clearance for a client who sustained an inhalation burns or injury. Which of the following nursing intervention should include in the plan of care for this client? Correct answer is option C. Elevated the head of bed. A nurse has developed a nursing diagnosis of ineffective airway clearance for a client who sustained an inhalation burn injury. Which of the following nursing intervention should include in the plan of care for this client? Elevate the head of the bed. Question number 94. A nurse in the telemetry is monitoring a client for cardiac changes indicative of hypoxemia. Which of the following, if noted in cardiac monitor, will indicate the presence of hypoglycemia? Correct answer is option B. ST segment depression. ST segment depression indicate the presence of hypoxemia. Question number 95. A client who sustained an inhalation injury arrives in ER. On initial assessment, the nurse notes that the client is very confused and combative. The nurse determines that the client is most likely experiencing hypoxia. Client who sustained an inhalation injury arrives in ER. On initial assessment, the nurse notes that the client is very confused and combative. The nurse determines that the client is most likely experiencing hypoxia. Correct answer is option D. Question number 96. The ER nurse is monitoring a client who received treatment for a severe asthma attack. The nurse determines that the client respiratory status has worsened if which of the following is noted on assessment. Correct answer is option A, diminished breath sound. In ER, nurse is monitoring a client who received treatment for a severe asthma attack. The nurse determines that the client's respiratory status has worsened if which of the following is noted on assessment. Diminished breath sounds. Correct answer is option A. Question number 97. The following are the effects of undernutrition the body except. Correct answer is option D, hyperthemia. The following are the effects of undernutrition of the body except hyperthemia. Correct answer is option D. Question number 98. Individual will be considered malnutritioned if his BMI is. Correct answer is option A, less than 18.5 kilogram per meter square. Individual will be considered malnutrition if his BMI is less than 18.5 kilogram per meter square. Question number 99. The following route preserves intestinal mucosal structure and function. Correct answer is option B, enteral. The following route preserves intestinal mucosal structure and function. Enteral is the correct answer, option B. Question number 100. A 30 years old man is admitted in the emergency ward with sudden onset of severe shortness of breath, no chest pain, diffuse wheezing, cyanosis and a BP of 70/30, pulse 100. This event occurred soon after a meal. What is likely diagnosis? Correct answer is option C, anaphylaxis. Correct answer is option C, anaphylaxis. 30 years old man admitted in an emergency ward with onset severe shortness of breath, no chest pain, diffuse wheezing, cyanosis, BP of 70/30, pulse 100. This event occurred soon after a meal. What is the likely diagnosis? Anaphylaxis.